Every 12 minutes, someone dies in a motor vehicle accident in the United States. Every 10 seconds, an injury occurs on our roads. I'm Dr. James Zender, and I'm a psychologist, and I would like to share some information with you about my experience of working with patients who have been in auto accidents. For the last 15 years, I've specialized in treating auto accident trauma. In the United States last year, in 2016, over 40,000 people died in U.S. highway accidents, and over 4 million were injured. There were over 300,000 cases of traumatic brain injury resulting from the accidents, and as many as 33% developed post-traumatic stress disorder. Think about it in terms of during the entire Vietnam War, there were 58,000 deaths. We're approaching that number in 1 year in highway fatalities. How do we prevent so many auto accidents? Research shows that 94% of accidents are due to human error and potentially totally preventable. The major causes of accidents are distracted driving, driving while impaired under the influence of alcohol or drugs, or speeding. The fact that these things are totally within the control of the people doing them is really maddening when you think about the pain and suffering and the destruction of lives and lost economy that these accidents are causing. The total overall cost to the U.S. economy is estimated at around $900 billion. We're approaching $1 trillion a year in economic costs from accidents that over 90% of them could be preventable. My passion about prevention is fueled by my clinical work of seeing patients suffering from injuries that I know could have been prevented. I hear story after story about someone who nearly died and they're suffering all kinds of physical injuries and traumatic brain injuries because a drunk driver hit them head on. Research shows that when we drive 1 mile, it requires over 200 decisions for us to make. Driving requires our total concentration. Auto accidents have been costing employers $60 billion a year due to lost time, lost productivity, property damage. So companies such as GM, Nationwide, and many others have instituted employee driving education programs that consist of many components, including incentives for safe driving. And these companies have reduced the number of accidents with their employees dramatically, sometimes 40–50%. The Insurance Institute of Highway Safety, which is funded by most of the major insurance carriers. And they're an organization that is focused on scientific research and communication to address the problem of road safety. And because of their work since 1959, they have come up with many things that we take for granted, such as airbag laws and safe bumper laws and child safety seats and seatbelt laws, red light cameras at intersections for people who blow through the intersections. They've done a great deal. I can only imagine how much worse things would be if there had not been that organization which has been working very closely with the auto manufacturers to make safer cars. They're actually making cars now that have driven millions of miles, and there have been no fatalities in them. I am honored to work with individuals and organizations whose missions are to make our roadways safer and to prevent accidents. so that people do not have to avail themselves to the kinds of treatment that I'm providing day in and day out. I welcome and look forward to working with you on this vital public health issue.